Let me tell you guys about a warning last night that came from the Mayo Clinic. They are concerned that some of these leading contenders to be off-label drugs that are used off-label to try and cure coronavirus, they could actually cause sudden cardiac arrest in some patients. That warning, again, coming from the Mayo Clinic. Dr. Michael Ackerman is a cardiologist at the Mayo Clinic. He's on the team that actually issued this guidance, and he joins us right now to talk more about this very concerning news. Dr. Ackerman, thank you for being with us this morning.
Good morning, Becky. Great to be with you.
Let's talk, first of all, you're a cardiologist, not an epidemiologist, so you are not making any judgment about whether these drugs are effective in treating coronavirus. You're just saying that there are some concerns people should know about beforehand if they are going to use those drugs off-label. And what are those concerns?
Yeah, as you said, I'm just a genetic cardiologist, so I'll leave it to Dr. Fauci and our infectious disease experts here at Mayo Clinic and throughout the world to tell us, do these drugs work? But what we do know as a cardiologist is that virtually all of these drugs that are being considered and being used have the potential to prolong the heart's QT interval, and in doing so increases the patient's chance for the heart to spin electrically out of control into a potentially dangerous heart rhythm. And if that doesn't revert back to normal, then that patient will go on to experience drug-induced sudden cardiac arrest and, worse, drug-induced sudden cardiac death.
What are the drugs that do this?
So the drugs are hydroxychloroquine and chloroquine with or without azithromycin that's being considered, some of the HIV antiviral agents. So all of the drugs that you're hearing about that now have become common names in the households across America and throughout the world, these drugs have this unwanted side effect. So I hope there is therapeutic efficacy. And if there is, we're going to be using them even more than we already are. And we need to make people aware of this side effect. It's manageable. It's one thing. These are powerful drugs. And it's one thing if that drug side effect is runny nose and lightheadedness and dizziness once in a while. It's another thing when that unwanted side effect is the tragedy of sudden cardiac death. So we can hopefully see therapeutic efficacy. We'll find out. We'll learn that. But in the meantime, we have to do everything to make sure that there's a healthy dose of respect, not fear, but respect for navigating the QT issue and the potential for drug-induced sudden death.
Those drugs are already being tested here in New York to try and see if they can help some of the sickest coronavirus patients. What would you advise doctors who are doing this? By the way, these doctors are overwhelmed at this point. They're doing their best, often without enough resources on these issues. What would you advise those doctors to do to make sure that their patient doesn't have these underlying issues? How do you check that?
Yeah, so it's one of the ways is to know your patient's QTC. What is that number? Just like for a diabetic, what is his or her glucose number, her sugar level, or their hemoglobin A1C? So the electrocardiogram, the ECG, can tell us what is our patient's QTC value. Is it too hot, too cold, just right? And when it's too hot or too long, we know that that's a patient who is potentially vulnerable. But if the system is overwhelmed and they can't even obtain an ECG to know what the QTC is, we need to at least do the mitigating factors to say, can I remove preemptively or correct preemptively any and all QT aggravating factors? So is my patient's potassium level normal? I better make it normal. Magnesium normal? I better get it normal. Are they on any drugs that already prolong the QT interval and are potentially setting up the patient? There's over 100 FDA-approved medications that can prolong the heart's QT interval and increase the chance for drug-induced sudden death. And so there's a very valuable, helpful website, www.crediblemeds.org, that maintains a list for our healthcare community of what those drugs are. So we can preemptively take care of all those factors, but if we could, we should try to know what our patient's QTC is, because 90% would be QT cleared with a green light go. They have plenty of safety margin, 90%. It's really that 1% that has a red alert value that they are approaching the edge of the cliff, and we better make sure that we have all appropriate QT countermeasures in place so that we can make that tragic side effect as unlikely as we possibly can. The problem, Becky, is the ECG, as you know, is a machine that a ECG technician has to walk in with, exposing him or herself to coronavirus, using up personal protection equipment and so forth. And so the FDA just gave emergency approval last Friday for a smartphone-enabled device to obtain the mobile ECG. So that mobile ECG from a LiveCore, for example, could be already in the patient's room and could provide the QTC in real time as sort of the patient's vital sign.
That's fantastic. Dr. Ackerman, thank you for bringing us these concerns and making sure people are aware of this. It's great to hear just about the innovation and how that's taking place. It could be done on an iPhone as well. If you have additional updates, will you make sure you let us know about them?
I would be delighted to. Thanks for having me this morning.
Thank you. Again, Dr. Michael Ackerman is with the Mayo Clinic. He's a cardiologist there and is part of the group that just warned last night that some of these drugs that are being considered as top contenders to be used off-label to treat coronavirus patients could have some side effects. There are ways to treat that, though.